It has been 40 years since HIV/AIDS was recognized as a global public health crisis. So where does New York City stand today in this ongoing fight against the disease? Here's Anthony Pascale with a look at how HIV/AIDS has evolved in the city.
According to research funded by the New York State Department of Health, in 2020, almost 85,000 people in the city were living with HIV. Despite healthcare advancements, the battle against this disease is far from over. Joining me today is Sharen, the Executive Director and CEO of Alliance for Positive Change, an organization that works to ensure all New Yorkers have access to HIV testing, treatment, and care. Sharen, thanks so much for being here.
Thanks for having me.
Obviously a very important topic. There have been so many advancements in the treatment of HIV. I know there are a lot of medications out there now that prevent the spread of HIV. So who is most at risk today?
Well, at the height of the AIDS epidemic in the 1990s, when Alliance was first formed, we understood very early on that disenfranchised, minority, low-income communities were hardest hit by the AIDS epidemic. And that remains true today. The LGBTQ community, people who use drugs, people who are living in poverty. Fast forward 30 years, we have access to treatments for HIV, but the challenge is really to ensure that folks who are living with HIV get tested and know their status, and then are navigated to access the medical care and treatment that they need.
So you have places where there's not a lot of access to health care. If people aren't going to the doctor regularly, they may not know that there are these treatments and other prevention medications available to them.
That's true, and of the 87,000 people who are living with HIV in New York City, the vast majority, 94%, have been diagnosed, but only 61% are consistently connected to medical care, and 78% are virally suppressed. So what does that mean? That means that 1 in 5 New Yorkers living with HIV do not have access to the medications and treatments that they need in order to achieve viral suppression. Undetectable viral loads means that a person will not, cannot, does not transmit the virus. So if we utilize treatment as a form of prevention, then we are going to be able to end AIDS by ensuring that every person living with HIV has access to that care.
And I know a lot of people during the pandemic were worried. You know, people were staying in, they were afraid to go out, they were certainly afraid to go to doctors' offices, and HIV testing rates dropped.
That is very true. 50% of HIV testing centers across the country experienced a drop, 50% drop in testing.
Have we rebounded at all?
We have absolutely rebounded, and in part, organizations like Alliance that have mobile testing vans and community testing centers are ensuring access to free and confidential testing. The other thing that has happened is that the HIV community figured out how to offer HIV testing in broad community expanses. And we've taken that model and have integrated HIV testing, Hep C screening, and COVID testing into one place. And for those who test negative for HIV, we can navigate you to treatment for PrEP, pre-exposure prophylaxis, so that we can keep you negative.
Your organization helps support those living with HIV and AIDS. What does that support look like?
Well, as the treatment advances have enabled people to live longer, so too have our services evolved. So we really seek to address the whole person. We offer housing, pharmacy, harm reduction, job placement, peer training. And it's this holistic approach to care that is really helping people overcome barriers to accessing medical care and achieving health and wellness.
And I want to end with this. If you know someone with HIV, what is the best way to support them?
Well, one thing that Alliance has done is we have created a peer training and job placement program with the support of Congresswoman Maloney and Senator Schumer. That job program values the lived experience as a job qualification. So someone who is living with HIV, has navigated complex health systems, is managing their recovery from alcohol or substance use, they become the health educator and messenger and resource connector to services. And they are inspiring other people to take charge of their health And in protecting ourselves, we're also protecting the people around us.
That is very true. Okay, Sharen Duke, thanks so much for your time today. And if you'd like more information, you can head to their website, alliance.nyc.